Mask recommendations are making a comeback in New York as the city sees skyrocketing COVID, flu, and RSV cases.
New York City health officials are strongly recommending people wear masks in indoor public areas and crowded outdoor settings, regardless of vaccination status. Now, this comes as the city sees flu hospitalizations at their highest level in more than a decade for this time of year. New York City health officials are reporting flu cases made up 12% of all weekly emergency department visits. They also reported COVID hospitalizations were up 26%.
Joining us with more now is Commissioner of the New York City Department of Health and Mental Hygiene, Dr. Ashwin Vasan. Dr. Vasan, thank you for being here. The mask recommendations actually are coming regardless of vaccination status or previous infection. Why is that, and does it tell us something about the decision making and the seriousness that you guys are seeing?
Yeah, thanks for the question. We are definitely seeing a rise in respiratory illness of several kinds. We're seeing high COVID transmission, we're seeing high flu cases, as you described, and we're seeing high cases of RSV, which mostly are affecting our pediatric population. For all of those reasons, that's why we issued the mask recommendation, because we know that masks protect against respiratory viruses, regardless of whether you're vaccinated or not. We want everyone to go into the next several weeks for the holidays as safely as possible. And we want everyone to have that congregate gathering that has been snatched away from us for the last 2 years. So that's why we put in this very strong and clear recommendation that when you're out in public, when you're doing your holiday shopping, when you're riding the subway, when you're in an elevator, just put on that mask, because that'll get you to your holiday season safely and healthy.
Well, Dr. Vasan, how close or far do you think we are from seeing a reinstated mask mandate? And what would have to happen before we would have to be reaching that point in the pandemic?
Well, look, here's how I look at it. COVID's with us, and it's not going anywhere anytime soon. The question is, how are we going to live with it, and how are we going to make smart decisions? I think over the last couple of years, people have come to think of public health as all about rulemaking and mandates. And yes, in a time of emergency, that was more than needed. But right now, we're talking about giving New Yorkers and Americans the best advice that they can get to take the safest decisions possible. That's so much of what we do in public health, is to get science-based information out there and then help people make the safest, healthiest choice, and to make it easy for them. We're not only are we issuing the recommendation, we're distributing masks at hundreds of locations throughout New York City to make it really easy.
Dr. Vasan, certainly you would know that making this recommendation is going to be met with pushback. And in fact, there's a lot of people who feel like perhaps we're getting more sick because our immune systems have been lowered because we have been so masked up over the last 2 years. What do you say to folks who are concerned about masks protecting us in the short term, but maybe not in the long term?
Well, look, I mean, I think there's a lot of theories about why we're facing what is really an unprecedented viral triple-demic, as we've called it. And maybe in past years, some of the masking and restrictions in congregation and gathering that we've had could be contributing to that. But my job as the city's doctor and as a public health official is to give the best guidance for now. And there are people getting really severely ill from COVID, from the flu, and from RSV right now. And my responsibility is to say, here are the steps we can take to ensure that all of us are safe, to reduce transmission, and to get through this holiday season safely and healthily. And, you know, we will adapt to changing circumstances in the future, but we have to make the best decisions for right now.
Dr. Ashwin Vasan, doctor, thank you so much for your time.
And thanks for all you do.
Appreciate you. Thank you.